Back pain, whether it's in the neck or the lower back, has been a very common problem, and in some cases treatments that are not been very satisfying. In the young group of people, fusion surgeries, which are usually done in the elderly, are really not an option because A, it reduces the range of movement, B, it causes increased stresses in the higher or lower levels, leading to degenerative changes, premature degenerative changes in those levels. And that is why we have been a little cautious in suggesting fusion surgeries in the young. So there has always been an interest in surgeries that will lead to no lack of movement. That is, the mobility remains the same. So one of the approaches was that you use flexible rods. What we have seen over the years using many flexible rods is that there is a tendency for these rods to snap at the level of the attachment to the screws in the vertebra. This is in the lumbar spine. So we were looking for the other alternatives like a total disc replacement. Total disc replacement is a fairly successful surgery in the cervical spine. Wasn't very much tried out in the lumbar spine because it involved a transperitoneal approach through the abdomen. Now, when it was first done, this is going back about 2 decades, the Charité hospital in Germany came out with what is called as the Charité disc. And this underwent many changes. And now, what we have in India is what is called as the Bagheera disc. This is by a company called Spine Art. The Bagheera disc is a very good alternative in young people with severe back and radiating leg pain, where only doing a discal removal procedure may not be enough. And these patients who, after adequate trial of physiotherapy, injections, etc., have still not improved, one could consider disc replacement. Disc replacement in the lumbar spine is carried out most commonly in the L5, S1 level and in the L4, L5 level. You take a phenensteel incision on the front of the abdomen and then go retroperitoneally, dissect out the vessels if any, be careful not to damage the nerves, and carry out a disc replacement. The advantage is you do a full clearance of the disc, you put in an artificial disc, and the movement of the spine subsequent to the surgery is excellent. In our large number of cases, slightly over 140, we have seen very good results. People getting back to sports, people getting back to being an armed forces personnel, and of course people who are in day-to-day lives. So with this little background, I would like to tell you that the artificial disc is a very good alternative in young patients with chronic back pain after failure of all other forms of therapy.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.